Hello student, and we'll begin with a new section in the evaluation and management, and that is the emergency department. So let us first understand the definition of the emergency department. It is an organized hospital-based facility providing unscheduled episodic service to patients seeking immediate medical attention. The facility must be operational 24 hours a day. So the important thing is it is basically it takes all the unscheduled episodic services and it has to be open 24 hours a day. So that is very important. So let us look at the code that we use it for the ED, and the codes are 99281 to 99282, 99283, 99284 and 99285. Now if you see all the codes has the medical decision making, that is a straightforward, then you have a low level, then you have a moderate level, and you have a high level of medical decision making. Now I want you to pay attention to the code 99281. This is the code. What is the code language? It says the evaluation and management patient that may not require the presence of the physician or other qualified healthcare professional. So this is a service can be carried out by the nurses, and that's why another observation you can make is this particular code does not have the MDA. Okay, so this is very important. So this is the table of the emergency department that is given in your book, and again quickly make some observation that this is the straightforward, low, moderate and high medical decision making, while the code 99281 does not have the any level of medical decision making. Now the another important thing is these are the code that we use it, and there is no distinction is made between the new or established patient in the ED. So here also you will see that this same code you can use it for the new and the established patient. We do not do that distinction between the new and the established patient. Important point to observe. So these are the two important guidelines, and they are service specific guideline. One is a critical care service. Critical care provided in the emergency department, we use the critical care CPT code 99291 and 99292. But to write that code, we will have to follow the critical care guideline. What is that? Critical care of less than 30 minutes total duration on a given date should be reported with the appropriate ENM code. What does it mean? Means whenever the critical care is given for less than 30 minutes, then we don't count it and we write the appropriate ENM code. So if it is less than 30 minutes, I'm going to write the ED code because we don't count that. And if it is more than 30 minutes given in the ED department, we will write 99291 and 99292. And this is when the emergency department service is going on. Okay. Now let's look at the second scenario. Both the critical care and emergency department, both codes may be reported on the same day if when after the completion of the emergency department service, the patient condition changes, then we can write the critical service and the critical service is provided, then we can write the emergency department and the critical care service code. So in this case, what has happened is his ED service was completed and then something happened to the patient and then he was given the critical care. So in this scenario, we can write both the codes. But in this, when the patient comes into ED, the doctor either gives the critical care of more than 30 minutes or less than 30 minutes, and depending upon that, we write the code. And then visit for the convenience. Patient seen in the ED for the convenience of the physician or other qualified professional use the office or other outpatient service code 99202 to 99215. So let's assume you have a patient, you have a appointment with the doctor at 10 o'clock. You go to the doctor's office and the nurse tells that your doctor is sitting in the ED because he's managing sir emergency and and he told me that if the patient comes, kindly send him to the ED. So you go to the ED to see your doctor, and that time the visit will be 9920222215, because it is the, yeah, the doctor is sitting in the ED, and that's why he is seeing, for his convenience, he is seeing the patient in the ED. Okay, and that's why the visit will be regular office visit, that we are going to code it. So these two are very important concepts. Now the third important concept is, when the patient is admitted to hospital inpatient or observation status, or to the nursing facility in the course of an encounter in another setting, we code it by the initial hospital inpatient or observation care or initial nursing facility code. So what does it mean? That means if the patient comes into the ED department, and by looking at the patient, let's say the patient is little serious, so the doctor decides, no, I want to observe this patient, and he immediately shift the patient to the observation status. So that time we will only code the observation status code. We will not code the ED code. So that is very, very important. And the next is, apply the correct modifier to indicate separately identifiable E&M service, the extent of the service provided as a part of the surgical package. Always make sure that if the modifier is required for that particular visit, see the modifier, see the definition, and apply the right modifier for the proper reimbursement. So let us begin our questions. So that will help you to strengthen the guideline. 86-year-old male present to the emergency department with a severe chest pain and shortness of breath. Wife gives the history. After thorough evaluation, including an EKG, chest X-ray, and lab test, the ED physician determines that the patient is experiencing acute myocardial infarction. The physician admits the patient to the hospital for further management. What is the appropriate E&M code for the service provided by the ED physician? So let us collect our data that the patient came into the ED, and then his EKG, chest X-ray, lab test was done. There was an independent historian because wife gave the history. So independent historian was present, and then the patient was admitted to the hospital. And we have a guideline here. So we are going to use the guideline to zero down our code. Now if you see the code, there are two codes for the initial hospital inpatient initial care, hospital inpatient care, and 281 and 285, it talks about the ED code. So let us see the answer. So here the guideline what we are going to use is that if the patient comes into the ED but then get transferred into the hospital, we are going to code only for the hospital. We don't code for the ED, and we have the guideline for that. And then if you see all the data, it inclines towards the high medical decision making, because 3 to 4 tests, independent historian, everything has been done, and the patient has been hospitalized. So we will use the code 99223. Now let us take the next question. How does the CPT professional edition define the emergency department? And I'm going to give you 1 minute to go through all the options. Pay attention to the unscheduled episodic service, that is very important, and secondly is 24 hours availability. So I would suggest that go through all the options and give me the right answer. I'm going to wait for 1 minute. Yes, So what is the important word? It is organized, it has to be hospital based, it has to be unscheduled episodic service, then it has to be present for 24/7. So by taking all those important pointers, we will zero down our answer. So yes, A is the correct answer. It talks about the organized hospital-based facility for the provision of the unscheduled episodic service. Present who patient who present for the immediate medical attention, and the facility must be available for 24 hours. So you will highlight the important words and eliminate the answers to reach to exact correct answer. Now the next question. Patient was in ER complaining of the constipation with nausea, vomiting when taking Zovirax for his herpes zoster and Percocet for pain. His primary care physician came to ER and admitted him to the hospital and intravenous therapy and management of this problem. His physician documented detailed history, straightforward examination, and medical decision making of the low complexity service. Now, what has happened is the patient came to ER and he was complaining of the constipation, nausea, vomiting, and then what happened, he gets admitted to the hospital. Now we have a guideline here which we have already seen in the previous, that the patient has been admitted to the hospital, then in that case from the ER, then we will write only one code, and that is a hospital code. That eliminate my option A and B because these are the code for the ED. Now in between 99221 and 222, we will take the help of MDM level, and then we'll zero down our code. So what was our MDM level? It was low complexity service, and we will zero down the code 99221. I hope you remember for the hospital inpatient initial and subsequent day, we have only 3 levels of medical decision making, where the straightforward and low will be indicated by one code. Okay, so 99221 is the answer. A patient came into the emergency room with a wheezing and rapid heart rate. The ER physician performed a comprehensive examination and documents a medical decision making of the moderate complexity. The patient receives the 3 nebulizing treatment. The ER physician decides to admit the patient to the observation care for the acute asthma exacerbation and will continue to evaluate and treat the patient until the wheezing subsides. Which of the following is most appropriate CPT code to report this visit? Now we have the code 99284 and 99221, 221, 222 and 99284. So this is the code for ED. These two codes are for the initial care, hospital, inpatient and observation status, and this talks about both ED as well as hospital inpatient. Now we have the rule that if the patient comes to ED and then get admitted into the observation status or the hospital inpatient, we write only one code, that is where the patient has gone. So the patient went into the observation care and we will pick up the code. Now to that eliminates my option D because it is talking about only ED service code. Now in between these three we will decide the answer. If you see the option A, we never write ED as well as observation status, we write only one code. So A is also not the correct answer. Now in between B and C, what will decide our answer? So the level of the MDM will decide our answer. The level of the MDM is making of moderate complexity, and that will help me to zero down the answer 99222. So this is a very important question. Pay attention. 2-year-old is brought to ER by EMS for near drowning. EMS had gotten a pulse. The ER physician performed the endotracheal intubation, blood gas and central venous catheter placement. The ER physician documented total time of 35 minutes of critical care on this critical infant, in which The physician already subtracted the time for the other billable service. Select the E&M service and the procedure to report the ER physician. So what has happened is the critical care is given to the patient in the ER, and how long it is given? 35 minutes. So now we will have to use the guideline. What is our guideline? That if the critical care is given in the ER, we will use the 99291 and 99292 if they fulfill the criteria. What is the criteria? It has to be more than 30 minutes. We have here it has been given for 35 minutes. So we can use the 99291 and 292. And so, what are the options that we have? D is 99476 and 36556. This is not a correct code. Now C is, it is talking about the ED code, and then it is talking about the services that are given. Now when the critical care code is when we are writing the critical care code, then we will not write the ED code here. So C is not the correct option. Now in between A and B, let us look at the correct option. 9929125, then check the second code. The second code is for the central venous catheter placement. Central venous catheter placement, if you remember the guideline, it talks about the age of the patient also. What is the age of our patient? 2 years. And you check the code 36555, insertion of the non-talent centrally inserted central venous catheter younger than 5 years. So we will require the code 36555. 36556 is for the older than 5 years. So definitely this is not the correct code. And if you remember that in the multiple code, if one code is wrong, that option is wrong. So even that criteria also you can use to eliminate all B, C and D answer. So we will require a code 36555, and 31500 is an intubation endotracheal emergency procedure. So that also happened, and 99291 is for the emergency critical care. And if you see here, to report the critical care service provided in the outpatient setting, for example, like emergency department or the office for a neonates and pediatric patient up through 71 months of age. 71 months means roughly 5 years, because 12 months is 1 year. See the critical care code 99291 to 292. So we have put all the criteria, we have used the guideline. So let us see what's the answer. So yes, 9929125, 36555, 31500. Any services performed that are not included in the listing should be reported separately. Facilities may report the above service separately. So in this case, we will go with the answer A. Now let us take the next question. A 45-year-old male present in the emergency department at 9 p.m. with a mild chest pain and heartburn after eating spicy food. The ED physician performed a focus history and exam, ordered an EKG and determined it to be the acid reflux. The patient is given over-the-counter drug with the instruction to avoid spicy food and follow up the gastroenterologist. So what has happened? The patient came into the ED, and whatever the treatment that happened into the ED. Now here we do not have the MDM level. So we will have to derive that MDM level to zero down our answer. Now if you see the option 99202 is a office outpatient for the new patient. This is established patient office visit. This is a new patient office visit. Now here it is not office visit, it is a ED visit. So these two will go away. Now in between these two we will have to zero down, and for that we will take the help of MDM. So yes, 99283 is the answer because it is the low medical decision making. Remember, in the emergency department codes, we have the straightforward and low at a different level. EKG has been done, over the counter medication was given. So that will gives us the low medical decision, and the gastroenterologist follow-up is required. So it is a 99283. Now the next, a 7-year-old boy is brought to ED by his mother after cutting his finger while playing. The ED physician performed a focus history and exam, straightforward medical decision making, clean the wound and applies the skin glue. Wound care instructions are given. This is a pretty simple example. The patient came into the ED department. He did not go anywhere else, and we have the straightforward medical decision making. So if you see the code, out of that there are two codes which are wrong. This is the code for the established office visit for the patient, and this is the code for the initial care hospital inpatient observation status code. So we will eliminate option B and D, and in between A and C, tell me the answer. So the answer is 99282. Now why the answer is 99282? Because we have an important hint here that it is a straightforward medical decision making. Now the next question. A 20-year-old male was biking and collided into another biker. He fell off his bike onto the cement. He presented to the ED with a several minor laceration on his arms and legs, but no other complaint of pain. The nurse examined the laceration and determined that a simple wound care is warranted, and this patient does not require an examination by the physician. What code should be used? And we have the option. So first of all, who carried out this service? The service was carried out by the nurse, and in the emergency department we have only one code, that is for the nurse. The rest of the code require the presence of the physicians, and you know very well which is that code. Just tell me the answer. Yes, 99281 is the code which is in the emergency department, that does not require the presence of the physician or other qualified healthcare profession. So 99281 we will zero down. Next question. This 70-year-old male is taken to the emergency room with a severe chest pain. The physician provided history and examination. While the physician is examining the patient, his pressure drops and he goes into cardiac arrest. Cardiopulmonary resuscitation is given to the patient and diagnosis for the cardiac arrest is established. The medical decision making was of moderate complexity. So we are going to see all the code. Now, where did the encounter happen? It happened in the emergency department. So we will require the ED code. So that will eliminate option C and D. Now, in between A and B, we will have to check. So we will, there is a special service given, that is cardiopulmonary resuscitation is given, and there is a ICD-10 code also. So we will take all the code into consideration and zero down our answer. So let us see what's the answer. 99284, it is for the 284 is ED visit, moderate complexity. We have the moderate complexity here. Then 92950, it is a cardiopulmonary resuscitation, and 92970 is the insertion of a pacing electrode for the temporary pacing. That did not happen. So we will zero down the code. Just check the code I46.9. It is the code for the cardiac arrest that has also been mentioned here. So all the codes are right. And remember, for the procedure or service identified by a CPT code, that may be separately reported on the same date, and that has happened, so we will have to report that separately here. And this is the last slide, and this is how we have concluded our emergency department. The next important topic will be critical care.